Signs that your body might be having a stroke. There might be nothing more unsettling than noticing strange changes happening in your own body, especially when those changes point to the alarming signs of an impending stroke. But don't worry, you don't have to go through this alone. We've researched this topic and are here to guide you in identifying these shocking warning signs. Hello, I'm Dr. Marcos, and welcome to the You Stronger channel. Before we begin, I'd like to invite you to leave a comment with the city you're watching from. Life can get too busy for us to notice the vital messages our bodies are sending. That's why we're encouraging you to take a moment, tune into your body, and familiarize yourself with these signals. Don't miss the chance to learn about the early signs of a stroke. It's not just about protecting your health, it's a compassionate act of self-care. But before we get into this information, please subscribe to my You Stronger channel and leave a like on this video. I need as many likes as possible to help us reach and assist more people. Can I count on your support? The first warning sign is high blood pressure, often referred to as hypertension. It is the most important known risk factor for stroke. Imagine blood pressure as a measure of the force with which blood gently pushes against the walls of your arteries as it circulates throughout your body, all controlled by the rhythm of your heart. Normally, we consider blood pressure to be around 120/80, but if these numbers consistently exceed 140/90, it's a sign of high blood pressure. Now, this condition isn't just about the numbers. It's like a gentle reminder that our blood vessels, including those connected to our brain, are working harder than usual, and the heart has to pump much more to keep the blood flowing. Okay, let's talk about how high blood pressure and stroke are kind of old companions, but definitely not in a good way. You see, high blood pressure weakens the walls of blood vessels and can even speed up common heart problems. It can also cause small clots or plaques to detach, which might end up blocking blood flow to the brain. Not the best news. Remember, the higher your blood pressure, the greater the risk of a stroke, so it's a call to action to keep those numbers in check. So, why does high blood pressure knock on our door? Well, it's a bit complicated. It usually doesn't have a single cause, but rather a combination of factors. Things like family history, aging, yes, age plays a role, and even factors like weight, alcohol consumption, smoking, diabetes, and that salty diet we sometimes enjoy. All these contribute. But don't worry, we do have some control over it. Monitoring and managing your blood pressure is crucial. Regular check-ins with your doctor to keep track of these numbers are like a wise health checkup. And guess what? Lifestyle changes also play a huge part. Think regular exercise and maintaining a healthy weight. These simple steps can do wonders for your blood pressure. The second warning sign is fatigue. The feeling of constant tiredness might actually be a surprising clue that a stroke could be lurking around the corner. It's like a silent sign that deserves closer attention. As we dig deeper, we uncover some interesting connections. Fatigue isn't just about feeling tired. It's like the body telling you that something might not be quite right. And guess what? Lack of sleep plays a major role here, putting extra stress on the delicate balance of your body. Stress itself is another character in this story, silently affecting your well-being. To make matters worse, an unbalanced diet can step in, disturbing the harmony of your body and potentially increasing the chances of a stroke. The third warning sign is vision problems. Vision issues can actually give us some important clues about possible strokes. It's like the body raising a flag, telling us that blood flow to the brain might not be flowing as smoothly as it should. Now, when it comes to vision problems, there are a few common concerns we need to watch out for. Blurry vision, double vision, or even partial or complete loss of vision in one or both eyes. These are all part of that alert system. These are like little hints that our body is giving us. The fourth warning sign is sudden headaches. Those intense and sudden headaches, they're like the body waving a flag, especially if they're accompanied by other symptoms. Now, headaches come in all shapes and sizes, and it's worth understanding where they come from. There's tension, migraines, and then the classic sinus headaches. They're all part of the headache family. But here's the thing. When it comes to severe headaches and strokes, there's a connection we shouldn't ignore. If your head is throbbing and you're experiencing other symptoms, it's like your body is sending a coded message. By piecing these signs together, we can act quickly and maybe even reduce the risk of a stroke. So let's give these signals the attention they deserve and keep ourselves on the path to health. The fifth warning sign is tingling or weakness in the limbs. Feeling tingling or weakness in the face, arms, or legs isn't just a passing sensation, especially when we're talking about strokes. Let's take a look at the possibilities behind these feelings. We have pinched nerves, arthritis, and even carpal tunnel syndrome. These are like the usual suspects causing tingling or weakness. When it comes to tingling or weakness and strokes, there's a connection we need to understand. Think of it as the body sending clues that we shouldn't ignore. If you notice these feelings, especially if they're accompanied by other signs, it's like a call to action. The sixth warning sign is difficulty speaking. When it comes to strokes, difficulty speaking is not something to ignore. It's like the body's signaling that something might be wrong with your brain. Stuttering, slurring words, and having trouble finding the right words, these are all pieces of the puzzle. It's as if your brain and tongue are trying to sync up. Understanding the connection between speech problems and the risk of stroke is crucial. This is your body's way of transmitting messages that we must pay attention to. If you're facing these challenges, especially if they coincide with other warning signs, it's advisable to consult a doctor as soon as possible. The seventh warning sign is memory problems. For many people, the inability to remember everything clearly is just another sign of aging. While this may seem normal on the surface, recent research indicates that memory loss can be a precursor to a stroke. A recent study conducted by the University of Brasilia explored the importance of memory lapses as potential indicators of other underlying health issues. The findings, published in the journal Stroke, reveal a significant association between memory loss and an increased risk of stroke, especially among individuals with a higher level of education. While previous research highlighted the possibility of a stroke causing memory problems, this study took an innovative approach, investigating whether cognitive difficulties could serve as precursors to strokes. The results indicated that individuals with a higher level of education who reported memory lapses faced a 39% greater likelihood of having a stroke. It's worth noting that this group consisted of people with university degrees or advanced professional education equivalent. The eighth warning sign is loss of balance, a significant indicator of a potential stroke, mainly due to the implications of damage to the brain's coordination center. This coordination center, located within the brain, is responsible for harmonizing various sensory inputs and motor outputs, ensuring smooth and precise movements. When this center is compromised, it can lead to a loss of balance. Several factors contribute to loss of balance, including inner ear problems, muscle weakness, and side effects from medications. Inner ear problems, like vestibular disorders, can disrupt the signals sent to the brain regarding spatial orientation and movement, directly affecting the sense of balance. Muscle weakness, often resulting from various underlying health conditions, affects the body's ability to maintain stability and respond effectively to position changes. Additionally, certain medications can introduce side effects that impair balance. These effects may include dizziness, drowsiness, or changes in blood pressure, all of which can increase the risk of falls and loss of balance. It's important to note that these causes are not mutually exclusive. On the contrary, they can interact and worsen the risk of imbalance. The ninth warning sign is nausea and vomiting, which can indeed serve as red flags for an impending stroke, particularly due to their association with disrupted blood flow to the brain. The brain relies on a constant and well-regulated supply of oxygen and nutrients delivered by the circulatory system. When blood flow is compromised, as in the case of a stroke, it can lead to several neurological symptoms, including nausea and vomiting. These symptoms result from the brain's response to altered blood flow and its subsequent impact on its functioning. The brain's intricate control over the body's functions, including the digestive system, can be impaired when its blood supply is disrupted. This interruption can trigger the body's reflexes for nausea and vomiting as the brain tries to restore balance. Many factors can cause nausea and vomiting, and it's important to consider underlying causes in the context of a stroke. Although nausea and vomiting can indeed indicate an impending stroke, they are not exclusive indicators and may arise from other conditions as well. For example, food poisoning can irritate the stomach lining and trigger these symptoms. Viral infections, especially those affecting the gastrointestinal tract, can cause similar reactions as the body attempts to expel the invading pathogens. Motion sickness, caused by conflicting signals from the eyes and inner ear, can also induce nausea and vomiting. Currently, there is no empirical evidence suggesting the presence of warning signs months before a stroke. However, there are numerous risk factors that can significantly increase the likelihood of a stroke. These include high blood pressure, tobacco use, diabetes, high cholesterol levels, and heart disease. Vigilantly managing these risk factors, along with adopting a health-conscious lifestyle, is crucial to reduce susceptibility to a stroke. Additionally, in cases of sudden and intense symptoms, such as difficulty speaking, sudden numbness or weakness in the face, arm, or leg, or a severe headache, seeking immediate medical attention is essential. These symptoms may potentially signal the onset of a stroke and require immediate medical intervention. I hope this video has helped you. Share it with a friend or family member to spread the knowledge. Don't forget to subscribe to my channel. It will help this content reach more people around the world. Thank you very much. Legal disclaimer. This video is for educational purposes only, aimed at instructing the public on various topics related to medicine and general health. The information provided in the videos is not intended to replace medical consultations or serve as recommendations for any treatment plans. If you have any questions, please consult your doctor. Medicine is a constantly evolving field, and the videos are based on the most recent scientific articles available at the time of production. The videos are strictly for educational purposes only and do not disclose addresses or phone numbers of any office, clinic, or service.